What if the mirror has been trying to save your life and you simply have not recognized it? The skin you see every day can quietly broadcast a serious internal problem that most people overlook. Right now, there are 10 specific changes that nearly everyone writes off as aging or everyday stress, yet they can be urgent alarms from your kidneys. One of these signs is so common, you may have it already without realizing what it truly means. Welcome back to the channel. Your skin is sending signals that deserve your full attention, and brushing them aside could come at a very high cost. What you learn today will completely reframe how you look at those so-called harmless changes you have been ignoring. Here is why this matters. Your kidneys work behind the scenes to filter waste and balance your internal environment. When their function slips, toxins begin to accumulate in the bloodstream, and the effects ripple through your entire body. Some of the earliest clues appear where you can actually see them on the surface of your skin. Research shows that a large share of people with advanced kidney disease develop skin manifestations, and in many cases, these show up before other warnings become obvious. These are not trivial irritations, they are part of your body's alert system, telling you something serious may be unfolding. In this video, we will walk through all 10 warning signs. We start with the most dangerous one, the signal that 9 out of 10 people overlook until the damage is already done. Several of the signs we cover may surprise you, and the odds are good that at least 2 could be visible on your body right now. If this content could protect you or someone you care about, take a moment to subscribe and tap the notification bell so you never miss essential health updates like this. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional about any symptoms, conditions, or emergencies. The information presented has been carefully researched and verified. Source links are provided in the video description. 1. Pruritus, itchy skin. The first and most troubling sign to recognize is pruritus, also referred to as uremic pruritus or chronic kidney disease, associated pruritus. This is not the familiar itch of seasonal dryness. It is a fierce, unrelenting sensation that can push sufferers to the brink. What makes it especially deceptive is that the itching often occurs without a visible rash. It may begin as a mild annoyance, yet can escalate to an overwhelming urge to scratch, tends to intensify at night, and frequently wrecks normal sleep. Persistent scratching leaves its own damage. Many patients develop raw bleeding areas known as excoriations because the itch is so severe and so constant. Beneath the surface, several processes converge to drive this symptom. As kidney function declines, uremic toxins such as urea accumulate in the bloodstream. These substances can deposit within the skin and are released in sweat, where they directly irritate cutaneous nerve endings. Disturbances in mineral balance allow calcium and phosphate to form deposits that further aggravate these sensitive neural pathways. At the same time, the immune system shifts into a hyperactive state, fueling widespread inflammation that amplifies the itch. There is also a crucial neurological component. Opioid receptors in both the central and peripheral nervous systems become dysregulated, which helps explain why standard antihistamines typically fail to provide relief. The signaling that drives this itching is largely non-histaminergic, so medications that target histamine pathways miss the mark. Importantly, studies indicate that pruritus affects roughly 90% of people with end-stage renal disease who are receiving hemodialysis, making it the most common non-specific manifestation of advanced kidney dysfunction. 2. Uremic frost. Among the cutaneous signs of advanced kidney failure, none is more striking or historically recognized than uremic frost. The skin takes on a dusting of fine, whitish powder-like crystals, or a faint yellow film, a visible marker of profound uremia and impending decompensation of renal function. This is not a subtle change, it is a dramatic surface deposition that immediately signals a critical internal problem. Typical sites include the forehead, cheeks, and beard area, neck trunk, and the limbs. On touch, the skin feels unusually dry and scaly, and a noticeable ammonia-like odor may be present. What you are seeing on the surface are crystallized urea deposits that create the characteristic frosted appearance. The mechanism is straightforward but ominous. When the kidneys can no longer clear urea, effectively serum, levels rise sharply. Urea diffuses into sweat, and as perspiration evaporates, it crystallizes on the skin. Contributing factors such as impaired sweat gland function, shifts in skin pH, and underlying xeroses facilitate this surface crystallization and make the deposits more apparent. Quantitatively uremic frost is most often observed when blood urea nitrogen is extremely elevated, typically exceeding 200 mg/dl. Decades ago, this presentation was far more common. With timely initiation of dialysis, it has become rare in developed settings, but when it does appear, it should be treated as an urgent red flag. Although the crystals themselves can provoke intense itching, the real danger lies in what they represent: severe uremia and the need for immediate life-saving renal replacement therapy. Early recognition and prompt dialysis are essential to address the underlying crisis. 3. Blisters. Blistering disorders in kidney disease can be painful scarring and signal serious complications. The standout entity is Porphyria cutanea tarda PCT, which produces fragile blisters on sun-exposed areas such as the hands and face. These vesicles rupture easily, then crust and scar, and are frequently accompanied by darkening of the skin, increased facial hair growth, and milia, the tiny white cystic bumps. PCT arises from deficiency of the enzyme uroporphyrinogen decarboxylase, leading to porphyrin accumulation that reacts to sunlight and injures the skin. Hemodialysis does not remove porphyrins effectively, so symptoms may persist or worsen despite treatment for kidney failure. Other blistering conditions also occur, including autoimmune forms like linear IgA dermatosis, which is linked to IgA deposition and is seen in end-stage kidney disease. Because blistered skin is easily breached, secondary infection is a constant risk, making precise diagnosis essential. Management varies by cause. PCT is typically treated with phlebotomy to lower porphyrin levels, whereas autoimmune blistering disease often requires corticosteroids or other immunomodulating therapy. 4. Calcium deposits, calciphylaxis. Disordered mineral metabolism in kidney disease can produce calcium deposits that range from relatively benign subcutaneous nodules to a life-threatening condition known as calciphylaxis. Recognizing the difference is critical. Simple calcium deposits tend to present as painless lumps near joints and are usually harmless unless they involve sensitive areas like the fingertips. Calciphylaxis is far more dangerous. Here, calcium phosphate deposits block small blood vessels, causing exquisitely painful purple patches that rapidly ulcerate and form crusts. The skin often develops non-healing ulcers with a hard, woody induration, sometimes resembling scleroderma. The underlying process stems from severe calcium phosphate buildup in the setting of kidney failure, driving intense small vessel calcification and thrombosis that destroy tissue. Most often seen in patients on dialysis or after transplantation. When graft function declines, calciphylaxis carries a high risk of death from infection or organ failure. Early recognition and urgent intervention are essential. 5. Acquired perforating dermatosis. Acquired perforating dermatosis is a distinctive condition in which the body expels altered collagen and elastic fibers through the surface of the skin. It presents with intensely itchy papules and nodules that feature characteristic central keratotic plugs and small navel-like depressions known as umbilication. The lesions are commonly ringed by erythematous halos, reflecting surrounding redness and active inflammation. Distribution favors the back and lower limbs, but the trunk and other easy-to-reach sites can be involved, especially where scratching is frequent. Lesions may align in straight or curving lines, a pattern called cobnarization, in which repeated mechanical trauma from scratching seeds new identical lesions along the path of injury. This arrangement underscores the critical role of physical irritation in shaping both where the eruptions appear and how they spread. Pathogenesis centers on relentless pruritus as the initiating event. Ongoing scratching inflicts microtrauma within the skin, producing structural changes in collagen fibers of the papillary dermis. These damaged fibers are subsequently driven outward and eliminated through the epidermis, representing the final destructive step of the disorder. Histopathologic examination reveals hallmark findings. Epidermal invaginations, or dilated follicles, are packed with keratotic plugs that contain keratin, along with expelled collagen or elastic fibers, and neutrophils are often present within these channels. This constellation of features is considered characteristic of acquired perforating dermatosis. Approximately 10% of patients receiving dialysis develop this condition, which can arise before or after initiation of dialysis, and may also occur following transplantation if graft function declines. Individual lesions typically resolve within 1 to 4 months, but they frequently leave behind permanent dark hyperpigmented scars. Effective itch control is therefore central to management, limiting new trauma, reducing lesion formation, and minimizing long-term scarring. 6. Rashes. Kidney dysfunction often produces characteristic skin eruptions that reflect the dangerous buildup of waste in the bloodstream. These are not ordinary allergic flares, they are cutaneous expressions of uremic toxicity acting directly on the skin. The lesions commonly begin as small dome-shaped papules that itch intensely and scatter across multiple body regions. As older bumps fade, new crops emerge, and adjacent papules can merge into thicker, rough plaques with irregular surface contours. Many people also notice areas of reddened or darkened skin that feel different from surrounding tissue. These patches frequently have a denser, thicker texture and may show altered sensation, indicating involvement that extends beyond superficial irritation. The driving force is uremia, the accumulation of metabolites that healthy kidneys would normally filter and eliminate. These uremic toxins irritate skin structures and spark inflammatory cascades that become visible as rash. They likely stimulate the same complex neuroimmunologic pathways implicated in uremic pruritus, which explains why these rashes almost always come with severe itching. The result is a self-reinforcing loop. Scratching aggravates the lesions heighten the urge to scratch, and the barrier breaks down further. Such rashes are common in advanced kidney disease and signal-impaired clearance of waste products. The intense pruritus leads to scratching excoriation and a higher risk of secondary infection, a particular concern for individuals with weakened immune defenses. And edema swelling. Edema is one of the most visible and worrisome skin findings in kidney disease. It shows up as pronounced swelling that makes the skin look glossy, stretched, and tight because excess salt and water are trapped in body tissues when the kidneys cannot regulate fluid properly. 2 patterns are recognized. Pitting edema is the more common type and leaves a depression that remains for at least 5 seconds after you press on the swollen area. Non-pitting edema feels firmer and springs back without leaving an indentation. The swelling usually starts in the lower body, the legs, ankles, and feet, then may extend to the hands and the face. Puffiness around the eyes that is most obvious in the morning strongly points toward nephrotic syndrome, a serious condition marked by large protein losses in the urine. The physiology is twofold. Impaired kidneys fail to excrete enough sodium and water, causing fluid to accumulate within the bloodstream, and then seep through vessel walls into surrounding tissues. In nephrotic syndrome, heavy protein loss lowers plasma oncotic pressure, which further encourages fluid to escape from capillaries into the interstitial space. Edema often appears by stage 3 chronic kidney disease and tends to worsen as kidney function declines because fluid retention increases. Beyond discomfort and tightness, significant swelling can trigger shortness of breath, chest pressure, and added workload on the heart, raising the risk of acute cardiovascular complications that may require urgent medical attention. 8. Nail changes. Your nails can reveal kidney problems through distinct patterns. The hallmark is half and half Lindsay's nails, a sharp divide where the proximal half near the cuticle looks dull, ground glass white, while the distal half toward the tip shows a pink, red, or brown band. Another clue is Merck's lines. Mew's nails paired white horizontal bands tied to metabolic issues such as hypoalbuminemia, which alters nail bed blood flow and protein structure. Lindsay's nails may stem from hormone-driven pigment changes. These signs are harmless but clinically useful. Half and half nails appear in about 20 to 50% of people with chronic kidney disease, up to 84% when anemia is present, and roughly 8 to 13% of patients on dialysis. They do not prove kidney disease but should raise suspicion and prompt evaluation in context. 9 skin color changes. Kidney dysfunction can produce striking shifts in skin tone that function as valuable clinical clues. People may appear unusually pale, develop a gray or yellow hue, or notice broad areas of darkening known as hyperpigmentation. These are not subtle tweaks in complexion. They are obvious changes that relatives and friends frequently spot before the individual does. Each color shift points to a different process at work. Pallor commonly reflects the anemia that accompanies chronic kidney disease. Once the estimated glomerular filtration rate falls below 60 millisieverts. This pattern is widespread, affecting roughly 1 in 5 people with stage 3 chronic kidney disease, and at least 9 in 10 individuals receiving dialysis. The yellow cast arises from retention of pigments such as uric and carotene compounds that healthy kidneys would normally eliminate. As renal function declines, these substances accumulate within the skin, and the yellowish discoloration gradually becomes more apparent. Widespread darkening, or hyperpigmentation, is linked to the buildup of middle molecular weight molecules that dialysis does not clear efficiently. These compounds deposit in the skin, producing patches of increased pigment, often most visible on the shins and other exposed regions. The anemia of kidney disease has several drivers. Diminished erythropoietin production reduces red blood cell formation. Iron handling is impaired, inflammation suppresses marrow response, and red blood cells have a shortened lifespan. Understanding these mechanisms underpins therapy, which typically includes the use of erythropoiesis, stimulating agents alongside iron supplementation. 10. Xerosis. Extremely dry skin. Xerosis is not just a bit dehydrated. This form of extreme dryness produces roughness and a scaly feel the moment you touch your skin. In more severe presentations, a distinctive fish scale pattern can develop known as acquired ichthyosis, so the surface literally resembles the scales of a fish. The skin feels uncomfortably tight, splits easily, and forms fissures that are painful and vulnerable to infection. This problem does not arise simply because you are not drinking enough water. It stems from fundamental shifts in skin biology at the cellular level when kidney function declines. Failing kidneys disrupt the activity of sweat and sebaceous glands throughout the body. These glands normally release protective oils and help keep the skin's pH in a healthy range. With impaired renal function, natural lipid production falls sharply and the skin's capacity to hold moisture is severely reduced. Mineral disturbances intensify the damage. Elevated phosphorus, a frequent imbalance in kidney disease, contributes to marked dryness and irritation. At the same time, the body has difficulty utilizing key nutrients such as zinc and B vitamins that are essential for building and maintaining a resilient skin barrier. Research suggests that between 1/2 and 3/4 of people on dialysis experience xerosis. Dryness then feeds into pruritus, fueling scratching that worsens the surface injury. As the barrier breaks down, the risk of infection rises, which is especially dangerous for immunocompromised kidney patients who already struggle to defend against invading bacteria. When you learn to read the quiet messages your skin is sending, you stop reacting and start protecting your kidneys. Relentless itching, extreme dryness, sudden shifts in color, nail changes, swelling, persistent rashes, perforating lesions, fragile sun blisters, painful calcium-driven ulcers, or even a powdery frost on the surface, none of these are just cosmetic. They are alerts from inside your body. If you recognize any of them, document what you see, note when it started, and speak with your healthcare professional promptly. Early attention can prevent complications and safeguard your heart's skin and overall quality of life. If this video helped you, please subscribe and turn on the notification bell so you never miss life-saving kidney health content. Tell us in the comments which sign you have seen and what your doctor advised, and share this video with someone who might need it today. Source links are in the description for your review. Thank you for being here, and we'll see you in the next video.